Well, welcome back to complete our discussion talking about influenza. Again, I'm at Morton Comprehensive Health Services, and joining me again is Dr. Kelly Humphreys in Family Medicine. Let's jump in. I'm so excited here. Now, I want to really get in again these symptoms that people should definitely make sure they're contacting their physician for. You talked about if the flu symptoms tend to be getting better and then all of a sudden they worsen.
Yes.
You need to definitely contact them. If persons are not drinking well, and there are others such as if they're not easily arousable or they don't wake up very easily. Tell us about a few others, and also if you're relatively healthy, like you said, and you can just treat with hydration and ibuprofen and Tylenol, but if that fever is not responding within about 24 hours, you need to contact your physician. You just don't let it linger. What are some other signs that would be important for us to know that you definitely need medical attention?
Well, particularly if the upper respiratory symptoms get worse. If they're having trouble breathing, if a child is bluish around the lips, breathing very rapidly or very shallow, as you said, is not easily arousable, it's very irritable. Normally you can hold the child and it can be soothed, and all of a sudden the child is crying, you cannot calm it down. Those are not good signs, and you should see the physician right away.
Now talk to us a little bit about, when people, make sure people understand about the use of aspirin for children. That is a big no-no, unless your physician for some reason prescribes it. Otherwise we should not be giving aspirin. Tell people why.
Well, Rye syndrome, as you know, was quite a concern, and this first became evident back in the 70s. And as you know, once we became aware of this and we made the public aware of it, and we stopped using aspirin, we have seen almost no incidence of it. And of course now we really don't need to use aspirin because we have alternatives, very safe. Obviously ibuprofen and Tylenol, either one is perfectly acceptable for fever in children. Okay.
Now you talked a little bit about in our last segment about persons who might have sort of other health complications or be at higher risk. They need to be responsive a little bit sooner than the person that has a normal, healthy immune system and no underlying health conditions. Clarify for our viewers about these risks. What puts a person at higher risk? We want to make sure that they understand. We mentioned asthma and diabetes earlier, but I want to make sure that people understand this higher risk category.
Well, and besides asthma, I would say anyone that has any underlying lung condition, like emphysema, COPD. Because the influenza has basically the way it has killed has been through the respiratory complications. Even here in Tulsa, as you know, we have had a couple of deaths, and all of those have been due to respiratory failure.
Right.
And so if you have any underlying lung problems, you are considered at higher risk. Also, if you have any compromise of your immune system, and there are several different syndromes out there. Obviously, if you're HIV positive, if you are on immunosuppressive drugs, those all carry higher risks. If you have been treated for cancers recently with chemotherapy, you know, you would be at higher risk. So these are the individuals that need to talk to their doctors about being first in line, or at least second in line, to get the vaccine, and then very aware, you know, that they need to be treated or prophylaxed if they are exposed to it.
Right, and that's my message too. I want to make sure that caregivers understand that they need not delay. Don't wait before you take your children in for certain symptomologies, or to call if you're not sure.
Yes.
And ask your healthcare provider, this is what's happening, what do I need to do? Because sometimes the delay is what can lead to further and more dire consequences.
Yes.
Now, I want you to talk to me in this last little bit of time we have. We mentioned Tamiflu and Influenza initially in terms of being the drugs of choice for influenza. What do these drugs actually do? People wonder, well, what does it do? Will it just take away my symptoms altogether? I wish, but you know, does it take away my symptoms altogether? What do they do?
No, I wish that were the case. I wish it were. What it does actually is shorten the period of time that you have it, or it prevents you from getting it. And I talked about prophylaxing individuals that have been exposed to it. It has been shown to do that. so that if you have someone who has the flu in your household, the other members can be put on this medication and it can help prevent them from getting it. But it actually is both of these medications are antivirals. Tamiflu is in pill form or a syrup that you can give to children, so it's a liquid form. The Influenza is actually an inhaler, and you inhale it twice a day for 5 days, and both of the medications are taken only for 5 days, whether it's being prophylaxed or if it's for treatment. But if it's for treatment, it shortens the duration of your symptoms.
Okay, so instead of maybe if you were going to run a 4-day course, it may shorten it to a 3-day course.
Yes, but also because it is antiviral and is working against the virus that's causing all your symptoms, it also can prevent it from progressing to more severe symptoms. And that's one of the reasons why we're saying if you are at high risk and you get the flu, you should get on the antiviral medication.
Now, some people may wonder, okay, let's say you're at a high risk yourself and you have someone in your family that has influenza, so you want to protect yourself like you're saying, and so you get prophylaxed with this. Is this something that's going to last you throughout the influenza season, people want to know, or is it only for a certain length of time and I still need to get the vaccine?
Yes.
Clarify for us.
That's a very good question. No, I wish it did last throughout the season. It does not. You still need to get the vaccine. And I've had another question as well. People who say, well, I may have had the flu. I don't know. I had a low-grade fever, but I wasn't tested. Should I get the vaccine? And I would say yes, get the vaccine, because if you weren't tested, you don't know for sure if you've had H1N1 or the seasonal vaccine, get the vaccine because it will protect you then, and you may not have had it. So it's better safe than sorry.
Okay, so you're still going to need that vaccine.
Yes.
And are all of the office tests that they're doing, the rapid flu test, is it always going to pick up whether the person has influenza or not?
No, I wish it was 100%. You know, I don't know that we have very many tests, unfortunately, that are 100%. No, they don't. And for a while, the state was picking up every one of our rapid tests and taking them to Oklahoma City, and they were confirming. They're not doing that anymore because we're having such a surge. So right now, because all the flu activity we have is H1N1, if it's testing positive for influenza A, by default we're saying, well, that is swine flu.
Right.
So no, it's not 100%. I can't, but right now, they're doing spot testing. So, we're probably at 90-some%.
Okay, and the last thing I want to leave people with as I wrap up is that whether it's H1N1, see if you concur as the doctor, whether it's H1N1 or seasonal flu, you're treated the same. The H1N1 has shown itself to be actually milder than seasonal flu to this point. You need both vaccines because neither one covers for the other. And let's approach it in a rational, calm, but diligent kind of way.
That's correct.
Okay, thank you so much for joining me, Doctor.
Thank you.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments, questions, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/Health Alert USA. Take care, be vigilant, but also sort of be calm about it and approach it like you know influenza. Okay? Take care and God bless. This program would not be possible without the support of OU Physicians in Tulsa.